Thank you guys for joining us. I'm Sara Kooperman. I'm the CEO of SCW Fitness. It's wonderful to see you here. I see some of the same faces, but I see Carol and Donna and Mary and Paul and Sandra and Martha. This is great. I'm just thrilled to have you all. We've got some wonderful, wonderful presenters tonight, and I'm really excited. We're going to be talking about the ultimate guide to shoulder training. So first, a little bit of housekeeping. If you could move your mouse, go to the bottom of your screen. You're going to see, you guys know what to do. Sue from Jersey. You'll see the green share button. Go to the left. You're going to see the chat box. Type your name in and where you're from. I want to make sure you can use the chat box. We've got a little over 160 people registered. My guess is we'll get 50, 60 people to show up, which is, believe it or not, for us kind of small, at least with the 50, 60 showing up. Ask your questions. This is your webinar. We love this. It's 45 minutes. I'm going to suck as much information out of these guys as I can. They're brilliant. I met with them right before we turned on. It's like the biggest thing we did was like turn on a light bulb for somebody. Yeah, it was easy. The shoulder is one of the most complicated joints in the body, consisting of a multitude of mechanisms that must all work in tandem for proper function. And because of this, shoulder injuries can be painful, they can be frustrating, which I'm sure a lot of us know, and even hard to treat. So we've got Chris Gellert, who's joining us. He's a licensed physical therapist and a personal trainer and a national presenter and author. And Chris is president of Pinnacle Training and Consulting Systems. It's an educational company that creates evidence-based material for personal trainers. So we're really excited to have Chris. Chris, you got to show your toys. Show the toys you brought.
I got the shoulder, you guys. I
love this guy. He brought
got the spine, got it all. Yep.
I love it. I love it. And then Kennedy Lodato is a 30-year advocate of health, wellness, longevity, and fitness. And he's a 15-year veteran of the fitness industry. And he's also pursuing a career in natural medicine as well, which is really awesome. And you work with Jason, right?
That's correct.
Yeah. So Kennedy works with Jason, and I hope I'm pronouncing this correctly. Persad. Okay, I was close. I'm very proud of myself.
Very close.
Is a bioenergetic medicine practitioner who comes from a background of strength and conditioning, holistic nutrition, and manual therapy. And he's currently studying for his PhD in natural medicine from Quantum University. He has worked with clients ranging from professional athletes to breast cancer survivors. So these guys, they know what's going on. So Chris, I'm going to start with you.
Sure.
And what assessments can I use to locate the cause of shoulder pain?
You know, the great thing about looking at the shoulder is before we talk about the shoulder is doing a member, as you guys know, a real good subjective history, getting to know what they're coming from, what's their background, did they have a surgery? Oh, by the way, I meant to tell you, I had a rotator cuff. Well, tell me about it. That kind of information is really important. Or I went through impingement and you're like, oh, I think I know what impingement is. Tell me about it. I went to physical therapy. Get that information from the client in detail. If they had a total knee replacement, when was it done? You know, those kind of injuries. So that's the biggest part first and foremost. The second is looking at actively what they can do versus you can't passively do it, but both inflection and raising to the side, but things to like reaching behind their back, you know, behind the back test. How far can they reach? And looking at doing a wall test, a wall push-up, which looks at your scapular control, are little things, but stay within your lane. If someone has a lot of pain and they're struggling to lift up their arm and you know it sounds like a rotator cuff, it smells like a rotator cuff, it is a rotator cuff, refer them to a chiropractor, a therapist, a doctor, a surgeon. Don't try and fix them on your own, is my advice from a legal, ethical perspective.
I love that. I think Chris is a little scared of me because he knows I'm a lawyer.
No.
But he said this before we turned the camera on. He said, you got to stay within your scope of practice. But what I love is that you can, and we all know this as group fitness instructors and personal trainers, you can smell an injury. You know, you can look at a client and you can just sense what's going on. And Kennedy, you're nodding. Can you please share with us how you work with clients and assess them to see what's going on with their shoulders?
So first of all, I'll just add to what Chris said. It really is about questions and building relationships, right? If you ask enough questions and you really get the answers from the client, they really can lead you along the way. But in terms of the reason I'm nodding my head is because you've seen enough movement, you've seen enough bodies over the years. You can just simply look at someone. You can look at foot position, knee position, hip position, their thoracic spine position, and already you know there's going to probably be some issue in the shoulder joint or eventually in the shoulder joint. So I'm just looking overall, as Chris said, just an overall postural assessment, just standing there can tell you a lot just from that perspective there. And that comes with experience, of course. But even that being said, we all know what good posture apparently looks like. You know, look for the line that runs down the nose and down the spine, you know, from the side. Does the ear line up with the shoulder and with the hip, and the certain landmarks that we have to look at? So even just looking at someone, you can tell whether it's good posture or not, at least from a visual static position.
Yeah, you're absolutely right. I was teaching yoga the other day, and somebody did a forward fold, and we're live at the YMCA that I teach at. We're live. And she did a forward fold, and I looked at her back and I said, do you mind if I touch you? And she said, no, it's fine. And I drew the line, and it was like her spine, she had an S curve. And I'll be honest with you, I don't know what to do about that. I'm not a licensed, physician. I play a one on TV, right? Not. But what I can do is I can say, you have an S curve in your spine. Have you talked to a physical therapist? Have you talked to your doctor? She was just so surprised. I'm like, what's surprising? You have 3 kids. You've been carrying something on your right hip for 15 years. What are you? Of course, this is going on. And Jason, you also were talking about posture. And I love what you had to say again before we turn the camera on, but you were talking about how posture and these prolonged seated positions we're in really affect us.
Yeah, exactly. A lot of us, when we're seated, we're generally not sitting, upright by any means. We're all kind of like hunched forward, rounded forward. And we call that a first rib angle. And it's actually assessment they teach at the Czech Institute. And you're looking at the sternal notch and your C7 that sticks out. And that angle for most people is it's a steep incline because most of us are in this kyphotic position. And if we're in this kyphotic position where our trap ones kind of take over, we get really rounded in through the shoulders, but then also in the front, our rectus abdominis gets compressed down, our psoas starts to lock up, and then we go to stand up and we can't achieve this neutral position anymore. We kind of go back into this position, even standing up. And so sometimes unlocking a shoulder issue isn't actually in the shoulder at all. Part of it's in the shoulder, but the other part of it is globally, whether it's in through the oblique system, whether it's in through your rectus abdominis or even your psoas and into the hip flexor series. So, for those of you who aren't so aware as to fascial lines, the deep front line is a very important fascial sling system that you should learn how to work with your clients in order to assist in some of these upper body chronic issues.
It's also very interesting. I mean, obviously the pandemic has affected all of us on this panel tonight, but it's affected our clients. And Chris, you're actively personal training right now. I know, Jason, you pulled back because of the pandemic, but what are you seeing with your clients, Chris?
Well, like I said, I just have one right now that I'm seeing, and I'm going back to clinical care because I actually had burnout after 20 years of being a therapist. And I'm sure you can say and attest to as an attorney that it's so much giving. But the thing with my client that I'm training now, I've been training for 3 years, is has Parkinson's mildly, but she has a rotator cuff problem. So she has an ortho with a neural problem. And because of the medication, she's doing so well, but because of her attitude, her balance and stability is off the charts. Most Parkinson's clients lack reciprocal motion. They can't get their trunk to move. They're stiff. They're rounded, like Jason said, they're kyphotic, and they're just like boards. They're just this flat effect. And my client Louise is just the opposite. She's gregarious. She's chatty. She wants to beat this. She doesn't want to let it take it over her. So I don't do a lot of personal training now, but like I said, I have in the past, but you know, it's a breath of fresh air to work with her because I see the changes every single week that are being made.
And what, Kennedy, what are the main causes of shoulder injuries besides, let's say, posture? What other things are creating these injuries in the shoulder girdle?
Well, I mean, if we go back and look at what an injury is, and most of the time an injury doesn't necessarily happen in muscle, but it's mostly the tissue it happens in. So let's consider what affects tissue. So stagnant tissue, overused tissue, tissue that's not hydrated properly, tissue that's not fed correctly through nutrition. So it can be overactiveness. You can be too active. That can also create issues in tissue, which can lead to a shoulder injury, or stagnation, just being stagnant in itself. So it's not so much a question of what leads to it. I mean, almost anything can lead to it. But if we go, like I said, take a step further and look at what actually affects tissue itself, then as trainers or as fitness instructors, we have to consider, you know, what are our clients drinking? What are our clients doing? What are our clients moving? Are they in these stagnant positions all the time? And if we can even start to address and keeping the tissue healthy, well, then that's at least a beginning position to start with.
No, that's wonderful. We just finished our nutrition coaching summit. We had it last weekend. We had almost 300 people on it.
Oh.
Very interesting because I have no nutrition background whatsoever. I try to eat lean protein and eat a rainbow. That's like my ground, you know, that's my grounding. Stay away from sugar, eat a rainbow, and kill as many fish as possible. But it does fuel you and make you feel better. Jason, you're really pursuing a lot of the science, and you work with professional athletes, and you work with autoimmune conditions as well. What other things do you see that cause these shoulder injuries?
So believe it or not, every organ is connected to a muscle, you know, in some form or fashion. So, you know, for most of the females here on the call, you know, that time of month, menstruation usually results in some sort of low back pain, hip pain, muscular discomfort. And, you know, that is perceived as something that is normal and to be expected. Then again, some of these more chronic injuries that we have, we don't attribute to possible organ inflammation. So the liver and gallbladder meridian tend to run down the right side of the body, along the right side of the head, down through the anterior delt and all the way down to your foot. And a lot of people who tend to have shoulder issues actually have some sort of liver or gallbladder issue. In traditional Chinese medicine, we talk about frozen shoulder and its relation to the liver as well. And so we have to look at, you know, there is potentially an organ issue going on. A lot of people have, you know, migraines and headaches, and, you know, any sort of therapist may attribute that to the lack of mobility in the neck, but also the amount of tension in through the neck. And we have to remember that any sort of shoulder issue is also a neck issue. Like, you can't separate the neck from the shoulder. They're so interconnected that you have to, you can't separate the two because they're just so interconnected. So, you know, looking at any sort of mobility issue, not only do you want to look at it from a musculoskeletal point of view and a nutritional point of view, as Kennedy said, and then a postural point of view, but then if things still continue to not get better, there is a whole nother world, which is like the organ side of things. And so I've had people with, you know, scapular issues or range of motion issues in the shoulder, and we work on cleaning up, say, the liver or the gallbladder, and working through that meridian line there. And then we see improvement in their range of motion without necessarily doing the manual therapy or the exercises per se, just understanding things that there's different layers of connection in the holistic world.
I find that fascinating because I also, you were talking about, like, it's almost like it crosses the body. I actually had right hip issue, and I was talking to the chiropractor who was very into Chinese medicine and very into not cracking, but manipulating, doesn't crack. And he worked in opposition for me. He started with my hip. I'm like, hello, I just talked to you about my shoulder. Right. Stop touching me, right?
And I would be the guy at your foot telling you it's a foot problem.
Yeah, and he just Thank you very much. He went right, he went all the way down the leg, he went into my feet, whatever. I don't know what he did, but my shoulder does feel better. But I find that fascinating when we look at what are the causes. And we also, when you talk about the neck, which is where so many people are housing their tension, and we're sitting on couches, and we've been on our phones for what, 15, 18 months now, and sitting in front, you know, if I Zoom one more time, yeah, we're like zoomed out. It's, although it has brought us all together, you know, thank God for Zoom. I really, I can't criticize it. But what exercises might you guys recommend? Jason, I'm just going to start with you because we just finished with you. But what exercises are best to increase our range of motion in the shoulder girdle, and why might that be important?
So we have to understand that the shoulder itself is a ball and socket joint. So it has the capacity to move, you know, all the way around. And generally, if we have a client with some sort of pain and discomfort, there's going to be a portion of that they're going to have issues with. And the key in doing a proper assessment is understanding that, okay, is this more of a lat issue, in which case I can't get that arm all the way up, I'm kind of stuck down here. Am I doing some sort of scapular test on the wall, as Chris mentioned, and the shoulder blades just aren't doing their job? So identifying, you know, what is dysfunctional would be your first step, right? And once you identify that, you know, for me, anything in and around your scapular retractors, those trap 3 muscles, are your main shoulder rehab muscles. So you mentioned rotator cuff earlier. Like if I just took a band, let's talk about a band that people use for glute work, and I just put that on my wrist and was doing some sort of extension here, trying to use my shoulder blades. If I'm on the ground, any sort of horse stance, right? Just literally just holding your body and stabilizing in that position. Another exercise would be a negative push-up. So if I was doing a push-up and my arms are locked and I'm just working on letting my torso come up and down, I'm actually training the serratus to work with the rib cage and move up and down. And a lot of people have issues with their shoulders, not so much because of the shoulder, as I mentioned, but due to inability to stabilize the scapula, which is your trap 3. And when we're like this, which most of us are, our trap 3s are elongated. They're long and weak. Meanwhile, everything down here is short and tight. And so we're trying to do the opposite pattern, right? And the other one would be with the negative push-ups, just trying to get the serratus moving again. Most people, if you kind of come in through here along the rib cage, they're kind of saying, ooch, ow, tender, you know, and that's because why? Again, that rib angle we're talking about, we're all compressed, everything is stuck, and they're having issues with extension.
And that's great. That analysis really helps. Chris, can you show us that fabulous shoulder of yours? No, the other two that are under the red shirt. And just kidding.
I think just to piggyback with Jason a little further, we've got to remember that, you know, the audience, you guys, whether you had anatomy or you've had a lot of anatomy or you've had no anatomy, there's 4 joints. In that week, the pain not only is not coming from the glenohumeral, it's coming from the AC, can be coming from the sternum, or as Jason's been talking about in Kennedy, on the scapulothoracic. So it really comes back to pain can kind of be hidden. It could be coming from different places. And the other thing I'd like to say, just to piggyback what Jason said, was all those are great exercises, but who wants really big upper traps? Stretch that tight upper trap. Stretch the upper traps, because the upper traps tend to be tighter. I've never in 20 years, you guys, and as the audience, said to my client or patients, I want you to do strengthening of the upper trap. Yeah. The low traps, the mid trapezius, is weaker. So we want to do rows. We want to do low trap pull downs to, again, like Jason said, is help bring the shoulder blade down, and most importantly, have that rhythm so it goes up and out. And that's the key thing. But the other final is stretching those pecs. I think stretching the chest, stretching the pectorals, and then lastly, giving yourself a nice hug, the posterior capsule stretch. I've seen in my career as a physio, as a therapist, many, many women and men who are their posterior capsule, which again is this little fibrous band of tissue that goes around the humerus. It's on the backside, and then you get one on the front. And that
which is the humerus, the arm,
this is the humerus right here. This is the arm bone. Right here. Yep, yeah. That's the arm bone. Here's the capsule, which is the gooey tissue. You've got your bicep in the front. If I flip this around, this is the back, and this is the posterior capsule, and this again is the scapula. So you tend to see tightness more in the posterior capsule because, again, rounded shoulders, it doesn't create a lot of space for the humerus to move. It gets crowded, like my colleagues have said and the panelists have said. So everything needs to be free, but it has to move. The tissue has to move, the pliability has to be there, and it has to then be strong, stable second.
Yeah, that makes sense. And the initial explanation that Jason gave about it's a ball and socket joint. This is one of the most mobile joints in the entire body, along with the hip, that's also a ball and socket joint. But with the shoulder, you get even more mobility, and we're constantly using our arms in different fashions, reaching in front, reaching in back, slapping those children. Just kidding. We're just, we're the first time I hurt my shoulder, I was like, I had 3 boys in the back of the minivan, and I'm driving to hockey, and they're beating on each other. And I'm like, I'm reaching back there, stop it, stop, and we do these abrupt, well, not always, movements. Kennedy, what other exercises and what other movements do you recommend for the shoulder? Now we're a little bit more focused on personal training, which I think is perfectly fine, because in a group fitness class, it's not like you're going to scream, "Oh, stop." And I see Donna over there, and Donna, you seem to have something wrong with your shoulder, but we can always recommend things to people, saying, I'm not a physical therapist or a physician, but as a fitness professional, I might recommend you go see somebody, and here's you're tight, you should do this, you should do that.
So assuming we're in our scope, right? Working within our scope, of course. Listen, I've taught the personal trainers for 15 years. And the one thing I always make clear is, first of all, as Chris said earlier, if it's pain, it's out of your scope already, period. You got to refer it out. Simple as that. As a trainer, then, in terms of exercises, so I like where Jason and Chris went more from a therapeutic perspective, but let's even go to the simple things. Your simple lateral raises, your simple overhead shoulder presses, assuming that they have the ability to do that. Your simple reverse flies, like just the simple basic exercises that we do see in the facilities are some of the exercises, some of those internal and external rotation exercises to help the rotator cuff muscle. So that's more from a outside global perspective, but even from that, it's just very simple stuff. But I must add, like Chris mentioned, if all I'm doing are exercise for my shoulders and I'm not considering everything globally and the fact that I have to release my pecs to create space in that area, then all I'm doing is strengthening a problem, which might make the problem even worse. So when I say shoulder, there has to be other steps prior to it, like releasing tissue. But some of those basic exercises are fantastic. And that alone will give you range of motion. I know when I started training many, many years ago, we never really thought about range of motion. And the only range of motion that I was able to basically take on was if I could do a proper shoulder press, then I had enough range of motion. If I could do a proper bench press or a proper squat. So within those limits, I created that range of motion per se. Yeah,
and it's how we're going to live our life, activities of daily living. And I think what happens is it's I don't want to say the emergency situations that arise, but if let's say a grandchild is running into the street, you better grab them and pull them back, and it's these type of situations that cause the problems. Are there special training techniques? I'm going to ask Jason this. Jason, are there special training techniques that you might use if someone, let's say, is predisposed to shoulder injuries?
Generally, I'm not doing too much overhead. I already don't like to use a lot of overhead pressing activities with women, especially because women do like to use their neck and their traps to kind of do everything, to be honest. So when you start going in an overhead fashion, it just makes an already tight situation already tighter. So yeah, try to keep everything, basically no higher than shoulder width. And specialty exercises, one of my favorites is something called a prone cobra, where you're actually laying on your stomach and you're turning your thumbs up towards the ceiling in this kind of V pattern here. And I'm on the ground. And what we're trying to do in this pattern is pull our chest up off of the ground using all the muscles that we just spoke about. And a lot of that that is so difficult for so many people because of a key factor. So postural muscles should be able to work for a time under tension of 3 minutes. And I have yet to meet the average Joe that can hold a prone cobra position for 3 minutes. Why? Because we are in the opposite all day long, right? If I said, can you sit up straight? People will start sweating trying to hold that position versus they get into a slightly hunched position and they can sit there all day, you know? So that is one of my favorites because it shows people very quickly how much tension they have on the anterior side of their body versus the posterior side. And then if I can get them to just hold it for 60 seconds and they stand back up, they're like, whoa, I feel taller. I'm like, yeah, I know, because if I want to flex my bicep, my tricep has to relax. I want to flex my tricep, my bicep has to relax. It's the same thing when we think globally in our posterior chain versus the anterior chain. So prone cobra, that's a favorite of mine.
Interesting, like that exercise. There was a question here. Jackie wants to know, is there anything I can do for long head bicep tendinopathy? I thought it was my shoulder, but my tendinopathy was my diagnosis. Currently, ice, heat, stretch. Anybody?
Sure, right here. I mean, that I saw that and I went, whoa, I've had it. You know, the key thing that I think just everyone in the panel's addressed, but going back even simpler, is if you have an injury, you want to ice, you want to rice it, you want to rest, ice, compress, and obviously elevate if it's ankle or peripherally for 3 days. After that, you want to do heat for 3 days. And then you want to start to slowly stretch. If you're not seeing change and it's not getting better, it's time to see a therapist, aside from a chiropractor. But if the long head of the bicep is still irritated and you're stretching the chest, you're stretching the interdeltoid, and you've been doing exercises for the back, it's chronically annoyed and it needs help. You can't keep doing it yourself. You've got to see a medical professional. It could also be, you guys, and I'm not trying to make everyone laugh on the panel, there could be restrictions, as Jason said, in Kennedy, in the thoracic, where the thoracic may be restricted. That's causing a kinetic chain dysfunction up into the neck, which is affecting the shoulder position, which is affecting the chest. So it's not one piece. It has to be, the whole chain has to be looked at. So get some help if it's not getting better.
Okay, great. That's very helpful. 3 days of rice.
Yep.
3 days.
3 days to heat, stretch, and then start. If it's not getting better, start to really look into seeing a medical professional. Yeah.
Excellent. Now, Leslie asked any tips or additional cautions, but I'm going to add on to that. She also addressed senior focused shoulder exercise. We have a very, very prominent active aging clientele. We're actually doing an active aging convention in July. It's coming up. So what would we do with a 70+ person? Kennedy, any thoughts on that?
You know, it's hard to articulate sometimes a question like that in such a short period of time. So my simple answer is going to be this, just for anyone. I'm sure everyone on the panel will agree, but even our listeners, we overthink things sometimes because, oh my God, he's 70, or oh my God, he's 18, or oh my God, he's an athlete. And I think Chris said the best at the beginning. Look, if we take a deep breath, we ask all the right questions. First of all, we're going to figure out if it's in our scope. If it's not, then we already don't have to worry about it. But if it is within our scope, then A, do you have a qualification to train an older adult? And if you don't, then once again, reach out. But even some of the most basic things that you would do with anyone, you could probably do with a lot of the older adults. So what I'm saying is, let's not overthink it. If it's within our scope, we can work within it. And if it's not, it's always easier to ask and reach out to someone else. But I don't think people should be intimidated just because they are 70. But it's hard for me to say, what if that 7-year-old moves like a 40-year-old? Or what if that 40-year-old moves like a 7-year-old? So age is tricky as well because, you know, Jason will know, we see people that are 80 years old who move like they're 50, and there's people who are 40 who literally move like they're 70 years old. So there's really a lot of questions to ask. So I wouldn't overthink it, but I would take the same approach Chris said, ask the right questions, see what's within your scope, work with what you can. And if you feel it's out of your scope from that point, refer out. You know, one of the things our industry doesn't do enough of, or not good enough, I think, is we should be working together with physical therapists and chiros and the
I agree.
trainers and the strength and conditioning and say, hey, I'm just the trainer here. I've done what I can. Go see this guy because he'll take you to the next level. We do it in our business as bioenergetic medicine practitioners. Sometimes someone will need work that's out of our scope. We refer out. So I think there should definitely be more of that. And if there is, well, at the end, better therapists, better trainers, and happier clients.
I call it the
Amen to
rehab
that.
triangle, Sarah. The rehab triangle is you got the PT, you have the trainer, or the fit. I really don't want to say trainer is really a fitness specialist, and you've got the client. You've got this client that is the core, the nucleus of the triangle, and then really the doctor's over here, but the triangle should be these three people, and that's where we should be. We should be synergistically working together, and I think it's getting better, like Kennedy said, but it needs to be better. When I was in Australia, when I did my postgraduate work, they work together like peanut butter and jelly. They're like, but I mean, it's amazing, the cohesiveness. And I think everyone's kind of in a turf war in the US, and it's realizing, well, I don't know this, I know that, so, I'll just try to fix it. Well, if you're not getting it right and you're hurting somebody, what's going to be a problem? As an attorney, it's not good. It's really should be a holistic, synergistic approach, as Kennedy said. Definitely.
Yeah, that's very important. And we did get a question here, and Jason, I think I'll throw it at you. They asked, we've gotten a lot of questions, so I kind of lost it up here. But someone asked, what do you recommend? Do you recommend dumbbells, hand machinery, tubing, bands, kettlebells? Should I keep going?
The awesome part about rehabbing shoulders is you don't always need a lot. Depending on where the dysfunction is, some things are better than other things. My all-time favorite basic shoulder rehab is just getting our external rotators stronger, right? For a lot of people, we should be able to come out in this external rotation pattern. And for most people, they can't get out this far. They're kind of stuck in here. And it's because of how tight our internal rotators are. So doing some cable external rotation exercise if you have access to that. So, our cable is here, we have our weight stack, and we're trying to do an external rotation pattern in this method. The reason I don't like tubing for things like that is that at the bottom of the strength curve, there isn't much tension, and at the hardest part, there's the most tension. So that's not ideal. But a cable is the same tension throughout the entire strength curve in that format. If I was doing it with a dumbbell, so let's say my elbow's on my knee and I'm going up and down, then a dumbbell is a great exercise because it's the same, whether it's a plate, a dumbbell, a bottle of water, if you're with an older client, like it really doesn't matter. It's just what can you use to create resistance along the strength curve without injury and without pain.
Yeah, and that's great advice, because I do see a lot of people using tubing. I'm a big tubing fan. I love it. I think it's wonderful. And during the pandemic, we couldn't get any hand weights.
Yeah.
Okay. We couldn't get any kettle weights. Which kind of scare me at some point. Not the fact that I couldn't get them, the fact that I think sometimes people are using them and using them incorrectly.
Yeah.
But Jason.
What I'm going to say is you can still use tubing. We just have to play with the strength curve. So if I'm in an external rotation pattern and I'm using a tube, then I might do an isometric contraction. So I might come up to that point and try to hold it there and get them to build strength near their end range. And that way the tension and load is consistent. And that's what I'm tracking in my programming if I'm working with this client using tubing. And so there's mechanisms and ways. We just have to understand the strength curve of the exercise to make sure that we're doing it properly.
I think just to add to Sarah quickly, his point is spot on, Jason. To add to that is, I think that we as men, because we're all men on the panel except for yourself again, that we do too much anterior, too much front, too much, this stuff here. We try to impress everybody. And the science says work the rear, and the rotator cuff, the external, like Jason said, are per the science, the weak link, the infraspinatus teres minor. So he nailed it. He's spot on. We've got to work those rotator cuff. And don't forget those tiny little muscles. Men think, oh, it's stupid to do that. Hey, it'll save you a shoulder surgery down the road. I'm telling you, it'll save a lot of money by working these little tiny muscles in those scapula retractors. Definitely.
And in fact, Chris, let me just add to that, Chris, and there's many who probably would agree, because we have so much of this forward, many will have started to say that there should be a 1-to-2 or 1-to-3 ratio for every push to pull. So you want to do one movement in this direction, you should be doing 2 to 3 times more this way and even possibly this way, but we do way too much in this position. So that's a good point.
Oh, that's fantastic, guys. I really love to I love to hear this. And also, what do you guys think about stretching? Because we're talking about strengthening 2-to-1, okay, or even 3-to-1. But what about the flexibility aspect? Jason?
Yeah, so there's an exercise I love. It's called the Big Bang mobility stretch, a Big Bang shoulder stretch. If you type in Big Bang shoulder stretch on YouTube, you'll get a couple of videos, and it's a 4-direction stretch. The first one is really focused on opening up the lat. So you have a band hooked around your hand to a rack, and really anything that you can stretch your lat out with, even holding onto a door frame or anything like that. You know, if you can't get your bicep up to your ear relatively straight, then you have generally a really tight lat. And if we want good shoulder mobility, we have to make sure our lats aren't super tight. Now, the problem is that because we're internally rotated so much of the day, and the lat being an internal rotator, it's tight. So, you know, now that we have tight lats, we've been sitting in front of a desk for a year and a half, we can't get all the way up. If you can't get all the way up, then things get tight in the anterior chain. So now your pec major, pec minor is tight, and you get all kind of rolled in. So mobility wise, anytime that I do an upper body workout, just because of the fact that my job requires me to sit at a desk, I'm focused on opening up my internal rotators, my lats, my pec. Generally, I'll do some sort of band stretching. I'm definitely going to get a lacrosse ball, kind of get into, like, you know, pec minor, pec major, a little bit of subclavius, maybe a little bit of anterior delt, depending on what I got going on that day. But, you know, that's what Kennedy mentioned in terms of prep work before an exercise. You know, depending on what you're training that day, we should be prepping the tissue for some sort of work. And this is where you can work on a lot of mobility aspect of things. But we have to understand that if I don't create stability in the back end, then I will never have mobility in the front, because the body's just going to create it. Because there's a lack of stability, the body's just going to tighten everything up. The one thing I will add to that, and going back to what we were talking about earlier, is that even if we're not working with injured individuals and we want people to have a strong pressing motion, so say we're trying to get women to do push-ups, or we're working with athletes and we want a strong bench press, you know, focusing more on the scap retractors and the backside, like Chris mentioned, is what is going to create the stability for that press. I remember working with, you know, football players for their 225 bench press, and most of the programming was scap retraction work and scap stability work, and all of a sudden their bench press was going up. Why? We didn't have to do bench press. We were just creating stability and support within the system. So I think when it comes to shoulder, in terms of stretching or preparatory work, focusing on, you know, the idea of our pec major, pec minor, and the lat are big guys that we would want to focus on prepping for the shoulders.
And that makes a lot of sense. I think it was Diana that asked, do I do stretching exercises before I play tennis? Well, you've got to stabilize the back. I mean, if you're going to be doing all these, you know, forehand, backhand, etc., if you can strengthen the back and we can increase some of the mobility, that'll help. Chris, can you add on to that, please?
Yeah, I would say that's a spot on point. My only comment would be, I would probably, someone like Serena Williams or professional athletes or the average Joe and Jane who plays like I do, you want to warm up, make sure you warm up and then stretch. But I think the bigger picture that I've seen in the industry is, when do I stretch? You really don't want to stretch a cold muscle, because a cold muscle is inefficient. So you want to get mobility. So motion is lotion. I love that phrase. I heard it from a therapist. I forgot where I heard it, but you're right. Strengthen the weak, the posterior, stretch the tight, which is the anterior. And I think if the function and the goal is to improve your backhand, you need to have tissue mobility and joint mobility in order for the humerus to move. But then you want to work that pattern, as Jason and Kennedy said, to strengthen diagonally or functionally, not in the sagittal plane, not in the transverse plane, not in the frontal, but all three planes. So what are you trying to do? And then my other point about the senior, I've been seeing several questions on seniors. I would say, for the biggest picture, I've never ever really had a senior do overhead press. I can't think of when I said to a 60-year-old, 70-year-old, an 80-year-old or higher, and I know, Sarah, you're young 60, why should we do shoulder press? We don't need to do that. We can work the deltoid, we can work the rear deltoid, we can do these other things, planks, physio ball, and core from alternate point of view, and it works really well. And don't forget yoga and Pilates and swimming. I mean, there's a multitude of cross-training mediums and modalities that we should be using. That's huge, in my opinion.
And I mean, Kennedy, you're nodding. If you have something to add, please.
I was just agreeing because he hit it spot on. He took the words right out of my mouth.
I know. I love you guys. It's like I've got the three musketeers here. I'm in heaven. What signs? This is our last question because, oh my gosh, we're at 6:40 at least in Central Time. We're flying along here. What signs and symptoms of shoulder injuries should we be aware of when we're assessing our clients?
Well, look, I'll just quickly start with this. In terms of signs or symptoms, as I said when we first began, you can just simply look at someone. If you have a kyphotic posture, let's start with that one. If your posture is kyphotic, you will absolutely at some point in your career, in your life, lead to some kind of a shoulder problem. Because look, if I'm kyphotic, if my spine is curved, my shoulder blades won't move, this joint will get jammed up. So that's what I'm going to say. That's your simplest thing you can look at and go, the back is curved. Then you have to decide as a trainer, is it something I can do? Or should I say to my client, look, it's out of my scope, but you should go see this person because here's what it can lead to. So I teach trainers about nutrition and injuries. And the thing we teach them is you should be aware of them, but they're out of your scope so that you understand how to coach clients into going to see someone like Chris and understand what's happening. Someone who doesn't know that's an issue wouldn't even know to look for it. And then the injury happens. So that would be my first big one. Look for that spine at the back.
And I really like hearing this. I know it's like I'm sitting here at this webinar and all I'm doing is self-assessing right now. I have a big golden retriever. You saw my dog walk, but before we turned on the camera. And you know what I do? I'm always pulling. I keep the dog in the left hand. Okay. And I'm realizing the chiropractor lifted me up and started doing the scraping. I'm like, he figured out it was my lat. It wasn't my shoulder. It was, it's very interesting how everything works together. Oh my gosh. You guys have been fabulous. I'm going to take the screen real quickly. I'm going to show you guys a short video here. So let me share this with you guys just for a second. I'm going to show you real quickly. We're doing it's a functional trainer Apex conference. This is going to be coming up actually in August. And I'm going to start with this. And it's Saturday, August 28th and Sunday, August 29th. And you can register for one day or for both days, which is kind of cool. And I wasn't going to do this, but I have to show you, where is it? Here's our Active Aging Summit that we're doing in about 4 weeks. So take a look at this. And this is July 24th and 25th. Very cool. Really nice for us to have this. Oh, it started again. Hold on one second, everybody. Sorry about that. We've also got a wonderful live conventions. Chris, Kennedy, and Jason, I would love you guys to come and present for us live. You've been a wealth of knowledge. Thank you so much for joining us tonight. We've been putting in the chat box the links. Chris, can you please share with everybody where they can reach you? What is your website?
Yeah, it's pinnacle-tcs.com. I'll type it right here for you. And
Wonderful.
they can reach me. And then also, I just want to say thank you to you and then the panels for a diverse but an eclectic and a very dynamic presentation. It was awesome to be part of.
Yeah, this has been great. And Kennedy, can you please share I think your website is kennedylodato.com.
Yep, simple as that. First name, last name.com. Very easy to find. Absolutely. Thank you so much for having me here tonight.
Perfect. And Jason?
quantumhealth.ca. Nice and easy.
Quantum Health. Wonderful.ca. I think you're in Canada, right?
Yes, I am. Yep.
Fantastic. All right, guys, thanks for joining us. Last video, you got to see the live conventions that are coming up. I love these videos. Mike Lieber, who is our fearless leader right now, helping us run this webinar tonight. Fantastic stuff. I love this. The last webinar we were on, somebody recognized themselves in one of these videos, which was so fun because it's live footage from the conference. So I want to thank you all for joining us tonight. Stay in touch with us. We'll see you next Tuesday for our next webinar. And I can't believe I even have the topic, the role of social media after social distancing. Love it. See you Tuesday. Thank you, Mike Lieber, for running us. Bye, Jason. Bye, Kennedy. And bye, Chris.
Bye, guys.
Thanks, Sarah.
All right.
Be well.
Thank you.